Breast cancer, colon cancer, and heart disease. There's a test that can tell you if you have an increased chance for all three, and it's completely free.
Yeah, Fox 8's Madison Forsey took the test herself at Cone Health and sat down with clinicians to learn how it could help the people in the triad live healthier, longer lives.
Some people do feel like knowledge is power, and for those individuals, this is a perfect test for you to consider doing.
There's power in knowing who you are on the inside at a microscopic level.
You don't know unless you test.
This is Gene Connect, a Cone Health initiative in partnership with the company Helix, years in the making.
So we want the conditions to be hopefully preventable rather than treat them on the back end once it actually kind of shows something.
Those conditions: breast and ovarian cancer, colon cancer, and heart disease. To get started, it's simple. You can sign up online or by scanning a QR code in Cone Health offices like I did. Once you sign up and read through the terms and conditions, it's time for a swab.
It's just 2 cheek swabs. Do you have any questions for me before we get started?
I don't think so.
All right. And you're just going to swab the inside of one cheek about 20 times. Yeah. And that's it. That's all to it.
That's it?
Yeah.
So there's no poking, no prodding.
Much easier than any COVID, flu, or strep test. Then in 2 to 6 weeks, you have a whole new window into what makes you, you.
We did not find any DNA variants that would increase your risk for the 3 conditions covered by the test.
Right.
That's
so
good to know.
Of those things that we talked about, that means that you have a negative test.
Meaning there are no early colonoscopies, mammograms, or cholesterol checks in my future. If you were to test positive for those genes, Dr. Chad Haldeman Englert would give you a call to discuss next preventative steps.
Helix also provides additional information to you that doesn't show up in your My Chart, but could maybe be fun information that you might want to learn about yourself. And so we call those Helix traits. And so we can click on a few of those and look and see what a couple of those are, as well as your ancestry information.
Entertainment genetics is what the doctor calls it. Everything from how caffeine affects your body.
Well, the caffeine metabolism, just off the top, you don't need as much. That's very true. If I have 1 cup of coffee or more than 1 cup, I feel like I get shaky and very wired.
Okay.
Yeah.
To physical traits.
Oh, wow. Likely blue or green. Yeah.
All right.
Yep, they're blue-green.
Okay. Wow. Both.
I do have very curly hair.
Okay.
I'm very likely to tan, and I would consider myself a tall-ish.
Sure.
And maybe things you've never really thought about.
Okay,
Oh,
what
that's
about your
interesting.
earwax?
I don't know what dry earwax would look like, so I'm going to trust that it's wet, I guess.
This isn't going to mean you do or you don't. It means you're more likely to or less likely to, and so you can certainly have a genetic change.
14,000 people have taken the test so far, and their goal is to reach 100,000.
We're trying to learn about what types of genetic conditions might be running in our community or might be running in the United States.
The information they collect is used for broader research, but it's not associated with your identity. Your identifying information stays private.
We want people in our community to be healthy, and so how can we maybe identify people in a way that maybe never had that opportunity to before? And so then if we can test them, find something, then we can hopefully prevent them from getting the condition that maybe they test positive for.
Proving knowledge and prevention is power. Madison Forsey, Fox 8 News.
So they haven't quite reviewed.
There is no cost to participate in Gene Connect. If you would like to sign up or learn more, you can visit the website below or just Google Cone Health Gene Connect.